Uterine balloon tamponade, a balloon technology that is being used to tamponade the postpartum uterus to control postpartum hemorrhage. This involves inserting a rubber or silicone balloon into the uterine cavity and inflating the balloon with normal saline. Number 1, assess the woman's status. Number 2, assess the client's ability to follow instruction. Gather all items you will need for the procedure. 2 sterile gloves, povidone iodine, intrafollic catheter, saline solution for irrigation, 50 cc syringe, and condom. For easy accessibility. Good afternoon, ma'am. I am Shaina and I will be your nurse for today. Ma'am, we'll be doing emergency management for your postpartum bleeding by making a uterine balloon tamponade. I will make a balloon and inflate it inside your uterus to stop the bleeding. I want you to take a slow deep breath and stay still. Explaining the procedure to the client relieve anxiety and apprehensions. Ma'am, if you can stand up to urinate to the bathroom, I will assist you. But if you feel dizzy, I can offer you bedpan or I can insert a catheter that will help you to urinate. A full bladder can weaken contractions and delay the separation of placenta. Ma'am, I will assist you to lie down on your bed with your legs apart and I will drape what is not needed to be exposed. For easy visualization and provide privacy. I will start an intravenous infusion to restore the blood loss, and I will mix a medication to your intravenous fluid that will help your uterus to contract. It restores blood loss and treat shock to keep the uterus well contracted and stop the bleeding. I will wash my hand. I will put an antiseptic solution over the tie and I will put on sterile gloves. This protects you by preventing any accidental contact of a substance that could carry a microorganism through break in your skin. I will insert polycatheter halfway onto the condom balloon, leaving a small portion of the condom beyond the tip of the catheter. I will wrap one rubber around the balloon, tying tightly to the catheter and making sure it can't loose but not so tightly. It is to prevent inflow of water. I will insert UBT into the bleeding uterus, making sure that it is inserted in the cervical and into the uterus, and it is not just in the vagina. I will push 15 milliliter of NSS through the catheter into the poly balloon. I will refill 50 milliliter of NSS and attaches it in one-way valve in the catheter. I push the NSS in the main condom balloon inside the uterus. I will inflate the balloon by NSS up to 500 ml until it can be seen in the cervix. As the balloon fills with water, it inflates. It is to check if there is leakage on the inflated balloon. I will tape the catheter to the patient's thigh for gentle traction. Is it to apply gentle traction to the catheter? I will connect the drainage port of the catheter to the fluid collecting bag to monitor for the amount of blood loss. After the procedure, I will remove my gloves and wash my hands. It is for infection control. I will continue to monitor for the vital signs, urine output, fundal height, vaginal bleeding, and amount of blood loss. To monitor if the client is experiencing hypovolemic shock. I will document the procedure on the nurse's notes. If the bleeding did not subside, I will refer the client to a CEMONC facility. It is to provide accurate data in the care of clients.